Hi, and welcome to Module 2, Lecture 1 for Community Health Advocacy and Social Movements. This week's lecture is called Community Resources and Patient Advocacy. Our Week 2 learning objectives are analyzing the parameters of the Affordable Care Act, describing the difference between Medicare and Medicaid, identifying areas where the ACA was designed to help medically underserved or vulnerable groups, understanding the economic costs associated with the U.S. healthcare system compared to other nations, but also how these costs impact vulnerable communities. So week 3 readings and media, it looks like a lot, but these are fairly short videos and the readings are interesting. The credit for much of this presentation goes to Nancy Niles, the author of your textbook. So let's do an overview to begin with. ACA was signed into law in March of 2010. It was a divisive landmark legislation. The Congress was very split over the decision and it won by a small margin. Lawsuits were filed against the federal government about matters with the ACA. The focus of ACA were access, quality, and cost containment of healthcare, so it really had a public health focus. Nearly 50 initiatives implemented over several years were the goal of the ACA and the way that it was designed to roll out. There were some issues with the implementation of the individual insurance mandate, meaning the requirement for every individual to buy healthcare if they were not insured by an employer, which was effective on January 1st, 2014. The federal website also did not work initially, so millions could not enroll in a healthcare plan. So that were some blips in it, but I think altogether the ACA did a lot more good than harm. And we'll see that in the provisions on the next slide. So the major provisions for the ACA were eliminating lifetime and unreasonable annual caps or limits on healthcare, reimbursement with annual limitations prohibited by 2014. This was so important because people with expensive treatments weren't capped by their insurance company after 1 year or over a period of time, and they could keep getting their treatments covered by insurance. Providing assistance for the uninsured with pre-existing conditions was also a huge win for people with pre-existing conditions, meaning people who didn't have insurance but also had who have really expensive medical treatments and need coverage very badly. It was also instrumental in prohibiting the denial of coverage for pre-existing conditions for children, which is a major victory in protecting children, and developing a temporary national high-risk pool for health insurance for individuals with pre-existing conditions who had no insurance, and that pool existed till I think 2013, sometime in that year. ACA also extended dependent coverage up to 26 years old. And for me, this one, I added this bullet point in, which is creating systems of accountability and oversight for insurers and healthcare organizations to protect patients. So I found this a major plus point of the ACA to financially protect patients as well as create more access. Oh, sorry about that. Let's get this. So ACA establishment of healthcare.gov was a big plus for people to be able to access a health insurance marketplace, which was unveiled on October 1st, 2013. And it's a very accessible and helpful website to be able to shop for health insurance by state or by different criteria. So it didn't work initially, but it does work now, and it has been working for a long time. ACA also created a reinsurance program, which was in your book chapter, for retirees 55 and older who are not yet eligible for Medicare. So that was another provision. ACA health insurance marketplaces were so that states could establish health insurance marketplaces for consumers to shop and compare prices for health insurance, as I had mentioned in the previous slide. If states did not operate their own website, the citizens could use healthcare.gov, established by the federal government. So huge problems with its initial operation. If you remember that time period, low enrollment in October, November, December, and there was an overhaul of the website, and enrollment has increased since then. And now approximately 14 million new people have insurance. So more about health insurance marketplaces. Insurance plans must now offer a summary of benefits so consumers can compare health insurance plans. Insurance plans must offer essential health benefits. So there's a bare minimum criteria now that insurance plans must offer, such as outpatient services, emergency services, laboratory services, preventive services, and prescription drugs. Fines are levied if individuals do not purchase health insurance. And I think this could hit some vulnerable groups hard sometimes, especially if they're unemployed or uninsured, and they have to pay for it. But I think it's a long-sighted policy where if people are insured, then they wouldn't have to pay large amounts for emergency care or for other types of more costly treatments later in life. So ACA implications for vulnerable populations. So the implications, I just broke it down into a few different groups. Elders, there were many provisions there for elders. There's the Elder Justice Act, Independence at Home program, which was also good for people who are not elders but needing home care assistance. There's a reinsurance for early retirees and waiving cost sharing for prevention visits to the doctor. So beneficiaries of Medicare basically don't have to pay for the copay when they're getting prevention care. And then lots of implications for children's health. The provision in ACA where children must be allowed to have health insurance if they have a pre-existing condition was really important, as well as the expansion of CHIP, which is the Children's Health Insurance Program for children in low-income households. Low-income families and individuals, adults, benefited from the Medicaid expansion matching program at the state level, which was a program where the federal government would match states who were agreeable to expanding Medicaid coverage. So the baseline was individuals who are under 133% of the federal poverty line, and so the expansion would reach more of those people. LGBTQ, who's another vulnerable and also subject to a lot of medical discrimination. This population, there is a provision in section 1557 of the ACA, which was accountable for protection of this group of people, especially non-binary and trans people or transgender people. And LGBTQ, if I didn't explain it, was lesbian, gay, bisexual, transgender, and queer. Indigenous people also benefited from ACA with the Indian Healthcare Improvement Act for American Indians. Self-employment. So self-employment could mean, you know, tech startup entrepreneurs, but it could also mean people starting a cleaning business or a taco truck or a small business like that. So this was a mixed group of communities and people, but the Small Business Health Options Program, SHOP, helped people running small businesses. Wage laborers were not protected very well, but protected better by cafeteria plans. In chapter 2, pages 31 through 33, there's a whole list of provisions. It's a really good list. So as far as your lecture today, that's all I have. But just to think about what the implications of these provisions, if you think of a scenario where someone from one of these vulnerable groups got injured at work or had to call an ambulance and things like that, how in the United States, how detrimental that would be financially. But because of the individual mandate, which was requiring all individuals, all adults to purchase health care or health insurance, how less vulnerable it made even these vulnerable groups financially just because of the individual mandate or the expansion of Medicaid, Medicare to cover as many people as possible, ideally everybody. And while this isn't universal coverage, it's not the NHS as it is in England, the National Health System, which provides free healthcare. And it's nothing like that, but it's a step in the right direction in terms of advocacy for vulnerable groups and protection of patients, both in terms of financial protections and access to healthcare. So it's brought our health system a long way, and hopefully the ACA will improve with time. Maybe not in the current leadership administration that we have, but the ACA will in time hopefully evolve to increase coverage at a lower cost, improve safety nets such as Medicare and Medicaid health safety nets, and be a comprehensive system that lets healthcare be a human right in the United States as it is in other places. So have a great week, and we'll catch up with you in week 2 of module 2, or week 4 of the course.